Dementia is not one disease, and treating it like it leads families down the wrong path from the very beginning. If you don't understand the type of dementia you're dealing with, you might be responding in ways that actually make symptoms worse. I see this moment over and over. A family sits across from me and says, they told us it's dementia, but didn't say what kind. And suddenly, nothing makes sense. Why memory seems okay, but behavior is changing? Why is that logic worked last year, but doesn't now? Why medications helped someone else, but make things worse here? Families blame themselves. They think they're doing something wrong, but the truth is, they were never given the right framework. Hi, I'm Rosabel Sofel, neurology nurse practitioner, and I work with dementia clinically and also with families navigating this every single day. In today's video, I'm going to be teaching you the main types of dementia, how they differ in the brain, and how they show up in real life, and why knowing the type changes how you communicate care. Dementia is a syndrome, not a single disease. It describes a pattern of cognitive decline that interferes with daily life. But what causes that decline matters because different dementias damage different parts of the brain first. And the brain area affected determines behavior, personality, insight, in response to care. Alzheimer's is the most common type of dementia. It primarily affects memory early on. The hippocampus is involved first, which is why short-term memory loss stands out. Common early features include repeating questions, misplacing items, difficulty learning new information. But here's what families often miss. In early Alzheimer's, social skills and personality might look intact. That leads people to underestimate the disease. Over time, reasoning, language, and orientation declines. Alzheimer's progresses gradually, not suddenly. Vascular dementia is caused by reduced blood flow to the brain, often related to strokes, mini strokes, or the so-called TIA, or chronic small vessel disease. Memory may not be the first symptom. Instead, families notice slow thinking, poor planning, difficulty with organization, mood changes. Vascular dementia often progresses in steps. Not a smooth decline. Blood pressure control, diabetes management, and stroke prevention matter greatly here. Lewy body dementia is frequently misunderstood and misdiagnosed. It involves abnormal protein deposits that disrupt brain signaling. The key features include visual hallucination, fluctuating cognition, REM sleep behavior disorder, sensitivity to certain medications. Memory might be relatively preserved early on. Behavior, perception, and movement are often affected. This type of dementia requires careful medication choices. Some commonly used drugs can make symptoms actually worse. Frontotemporal dementia often appears earlier in life. It affects the frontal and temporal lobes of the brain. Memory may remain intact early on. Instead, families notice personality changes, loss of empathy, impulsivity, inappropriate behavior. This is often misinterpreted as depression, midlife crisis, or psychiatric illnesses. The brain's ability to regulate behavior is impaired. This is not intentional. Now, there is mixed dementia, which it means that there's more than one type present. This is extremely common, especially in older adults. Alzheimer's plus vascular damage is a very frequent combination. This explains why symptoms don't follow a textbook pattern. Mixed dementia requires layered care strategies. One-size-fits-all approaches fails here. Different dementias affect insight, emotional regulation, processing speed. What calms someone with Alzheimer's might escalate someone with Lewy body dementia. What works in vascular dementia may not work in frontotemporal dementia. Understanding types help you stop personalizing behaviors. Here's the biggest mistake families make. Families often assume all dementia looks the same, so they apply generic strategies, correcting, explaining, pushing logic, but the brain they're talking to may not longer process logic. This is not defiance, it's neurology. So instead of asking, why are they doing this? Ask, what part of the brain is struggling? That single shift changes everything. Now, if you're struggling with behaviors that don't match what you were told to expect, I have a free dementia resource center. This is part of a free dementia education series that walks through communication strategies based on brain changes. It is designed to help families respond with skill, not frustration. Knowing the type of dementia helps with medication decisions, safety planning, behavioral expectations, caregiver support needs, and it also helps families stop chasing the wrong solutions. Dementia care is not about memorizing symptoms, it's about understanding how the brain changes over time. When you know the type, you can anticipate needs instead of reacting to crisis. Dementia is not one disease, and families deserve more than a vague label. Understanding the type gives clarity, reduces guilt, and protects connection. If this helped you understand dementia more clearly, watch the next video in this series where I explain how dementia actually progresses and why stages don't tell the full story. Subscribe and stay with it because education doesn't just inform, it protects families. See you on the next video.